Neck pain. Why it keeps coming back, and what actually works. Neck pain affects almost every second person. And maybe you've already tried stretching. You pull, you rotate, you hope, but it doesn't really help. Or the pain disappears for a while, and then quietly comes back, even when the doctor tells you everything looks normal. And that's the frustrating part, because in most cases, the real cause isn't hidden on an MRI. It isn't a serious disease, and it isn't something that needs expensive therapy. The cause is usually micro behaviors, small things, daily things, things you never even notice. And once you understand them, neck pain finally starts to make sense. Morning neck pain. What it usually means if you wake up with neck pain and the first movements hurt the most, but after 1 or 2 hours it slowly improves. This is mechanical neck pain, and this is the case for most people. What's happening is simple. You slept too long in one position. Your neck drifted into a bad angle. Muscles stayed tense for hours. That tension reduces blood flow, less oxygen, less nutrient delivery, and muscles respond the only way they can. With pain, your neck is not designed to hold still. It's designed to move, gently, frequently. That's why long hours at a computer, scrolling on your phone, or reading with your head tilted forward, all slowly load the same muscles. Tightness builds, circulation drops, pain appears, not suddenly, but gradually. Head position changes everything. Your head position matters more than you think. In a neutral position, your neck carries about 5 kilograms. Move your head just 1 inch forward, and the load doubles. 10 kilograms on small cervical muscles. For hours. That's why posture isn't about looking straight. It's about reducing unnecessary load. If your neck hurts after cold exposure, or after lifting something heavy, that's usually muscle-related pain. But if pain shoots into the shoulder, down the arm, and worsens when you move your neck, that suggests cervical radiculopathy, meaning a nerve is being irritated where it exits the spine. These cases exist, but they are far less common. The vast majority of neck pain is still mechanical, and that's good news, because mechanical pain is manageable. Is your pillow the real problem? Here's something surprisingly practical. You can often tell if your pillow is wrong just by how your pain behaves. Pillow too low if pain is on one side, and tilting your head toward the painful side makes it worse. Your pillow is likely too low. Your neck collapses downward all night. Muscles overstretch. They protest in the morning. Pillow too high if tilting your head away from the painful side makes the pain worse. Your pillow is too high. Your neck stays bent all night. Muscles shorten. Circulation suffers. Sleep alignment. Second most important step during sleep. Your goal is simple. Keep the neck neutral. The easiest check? Your chin. It should stay parallel to the floor. Not lifted, not pressed down. Firmness matters too. A good pillow is medium firm. Your head should sink in about 1/3 of its height. Sleeping without a pillow is not neutral. It strains the posterior neck muscles and flattens the natural cervical curve. Side sleeping rules. If you sleep on your side, your pillow must fully fill the space between the mattress and your head. For most adults, that's about 12 centimeters. Side sleeping without a pillow almost guarantees neck pain. Why sleeping on your stomach is the worst. Stomach sleeping forces your neck into extreme rotation, often 70% or more. That stresses joints, reduces blood flow, and compresses muscles unevenly. People who sleep on their stomach experience neck pain far more often. The goal isn't perfection, it's gradual retraining. Body pillows help. They limit rotation. They guide your body naturally. You move anyway, so your pillow must adapt in real life. People change sleep positions up to 40 times per night. So the ideal pillow is not rigid, it's adaptable. Overall height, 10 to 12 cm, compressing to 7 to 9 centimeters under load. That balance supports movement without forcing posture. The third step, micro movements. Your neck needs movement, small, frequent, intentional, just 1 minute, several times a day. Especially if you sit or work at a screen. Exercise 1. Neck circles 5 slow circles clockwise, 5 counterclockwise. No forcing, no speed. This nourishes spinal joints by redistributing joint fluid. Exercise 2. Side bending ear toward shoulder. Right, then left. Shoulders stay down. Hold 2 seconds. This relieves muscle ischemia, meaning muscles finally get blood again. Exercise 3. Flexion and extension chin to chest, then gentle upward gaze, 8 repetitions. This supports cervical disc hydration. Exercise 4. Shoulder retraction, pull shoulder blades back. Hold 5 seconds. Repeat 3 times. Why this works? Spinal joints have no direct blood supply. They rely on movement. Motion circulates synovial fluid. That fluid carries nutrients, removes waste. Even 1 minute matters. Upper back strengthening can reduce neck pain by up to 40%. Wall YTW, back and head against the wall. Arms at 90 degrees. Slow. Controlled. 12 reps. 3 sets. Prone YTW, face down. Head supported. Y position, T position, W position. 8 reps each. Hold 5 seconds. This alone can reduce pain by up to 60%. When pain is already there, topical treatments. First-line diclofenac gel is the most effective option. Local action. Minimal systemic exposure. Usually 7 days is enough. Ibuprofen gel is slightly weaker but even safer. Capsaicin cream works on pain receptors, not inflammation. Safe for long-term use. Menthol creams activate cold receptors, distracting pain pathways. Short relief. Very safe. Oral medications, short-term only if needed. Ibuprofen, 2 to 3 times daily. Naproxen, once daily. Paracetamol, safer, but weaker. Duration, 3 to 5 days. Longer use increases kidney and stomach risks. Red flags. Do not ignore these: numbness or weakness in the arm, progressive loss of strength, coordination problems, balance issues, pain that worsens at rest, pain that wakes you at night, pain with fever, weight loss, night sweats, or any history of trauma. These need medical evaluation.